to see the seizures disorder. In other video, we're going to talk specifically about all the anticonvulsive medications, and in other video about specifically status epilepticus, that is the acute event in which the patient has the seizure. Here we're just going to talk about the chronic state. So the seizures could be divided into focal or partial, and the partial itself could be divided into simple or complex, and the other type is generalized. So in the partial or focal, that is when the patient presents with the seizure, whatever it be, but it's just involving one part. For example, it's just twitching of one arm or something like that. Simple means no loss of consciousness, and complex is loss of consciousness. Any one of these, that is the simplest or the complex partial seizure, can progress into the generalized seizure. Now, the generalized seizure could be tonic, clonic, absence, and atonic. Tonic is just the seizure is to be rigid. Clonic is the rapidly alternating movement. Tonic-clonic is periods of rigidity and alternating movement. Atonic is the loss of muscular tone that leads to drop. And absence, also called petit mal, is when the patient is like staring, when is like if the patient were on blank and is in blank or something like that. So it is not that the patient is not paying attention, it's just the patient has the seizure. Alright, so the absence issue is most commonly seen in children. Alright, now specifically for the tonic-clonic, the patient has incontinence or lip smacking. That is, when they say rapidly alternating movement, it is called automatism. In this case, could be the lip smacking or hand writing, that the patient just were writing. Additionally, the patient can have cyanosis in the episode because of involvement of the thoracic muscles, and the patient has the postcoital state. The postcoital state is like confusion or maybe some neurological symptom after the state, in the postcoital state. This about the cyanosis is important because in another video we talk about how to differentiate the seizure from the breath holding spell on the baby. And the other is the absence seizure. This is most commonly seen in children. It could be provoked by hyperventilation. That is, for example, if the child got scared or something like that, and now is hyperventilating, the patient would have this maybe. And it presents also, could present also with automatism. In this case, would be lip smacking. Also, here is tongue biting. Here, lip smacking, eye fluttering, or the movements of chewing. Alright. This absence state lasts for, could be 0.5 to 10 seconds, and the patient is not conscious about this. That is, the patient does not remember that something went on. And here is no postcoital state, very important, no postcoital state on the absence seizure. So the partial seizure can convert into a generalized seizure, specifically into the tonic-clonic seizure. Now the complex partial seizure can also have the postcoital state, because this is the only one between the partials that also has the let's say like loss of consciousness, so also have this postcoital state. And so the absent seizure does not have the postcoital state because there is no, let's say, loss of consciousness or something like that. It's just like staring on blank. And here, because it is focal, the presentation will depend on which part of the brain is affected. For example, frontal lobe will produce, for example, hand twitching, or paralysis of some extremity, etc. Olfactory or auditory hallucinations. This is due to the temporal lobe involvement. And visual hallucinations is due to the occipital lobe. Alright. So these are the seizures. Certainly the patient can present, for example, with a febrile seizure. Oh, yes, that other thing. The seizures, the first seizure of the life is not treated unless the patient has a family history or something like that. The epilepsy is where there are more than two, greater than or equal to 2 seizures with more than 24 hours apart. So that is just the disorder of recurrent seizures that is not due to a underlying disease, or underlying something like fever, hypoglycemia, or something like that. Now the diagnosis, we need to rule out the secondary cause. So we will ask for the complete loss count, chemistry, blood urea, nitrogen, electrolytes, natrium, potassium, sodium, calcium, magnesium, etc. Thyroid function test, many things. But the best next step, the thing that we need also to do, is to take a EEG. Now, in the EEG, we have characteristic findings. For example, in the absent seizure, we will have something called the spike wave of 3 Hertz. So it is a slow frequency. But the tonic-clonic would present, for example, with 10 Hertz, something like that. And so in the diagnosis, we will do the EEG. Now, for the treatment, look, in this video we're not going to talk about the acute treatment of the seizure. No, that is called when the patient has the seizure and is lasting more than 5 minutes. It is called status epilepticus. So the patient can have status epilepticus. We're not going to talk about that in this video. We will talk about that in the next video. Now, how we will manage this chronically, that is when the patient has recurrent seizures, that is when the patient has epilepsy, whatever of these ones, how would we treat this? And it depends which kind of seizure it is. In another video, we'll talk about specifically all the treatments that we can give. But as a rule of thumb, for partial seizures and the generalized tonic-clonic, we will give anticonvulsive medications. And this would include, certainly for the partial seizure, we will give either carbamazepine, phenytoin, levetiracetam, lamotrigine, valproate, phenobarbital. Lamotrigine is very aggressive, and on a pregnant woman, this carbamazepine, levetiracetam, lamotrigine can increase the risk of hyponatremia. But the most safe on pregnancy would be levetiracetam. And remember that in the first seizure, we are not going to give treatment, not treatment for chronic disease. Maybe treatment for stop the seizure. It will depend on which seizure it is, if it is febrile or not, something like that. So this will be the treatment. For the absent seizure, the first line treatment is ethosuximab. Ethosuximab inhibits the calcium channels on the hypothalamus. And the second line treatment will be valproate. For tonic, tonic-clonic, and clonic, in acute event, we will also give valproic acid. Just in the acute event, we can also give valproic acid, but if we are talking about the status epilepticus, we will begin with benzodiazepines, phenytoin, etc.